Sulfonylureas, such as Glipizide, Glimepiride, Glyburide, are medications for type 2 diabetes that work by stimulating the release of insulin. So we have cells within the pancreas called beta cells that produce insulin naturally. And when we have type 2 diabetes, we have a relative deficiency of insulin. Our body can't make enough of it for what it needs. So this class of medicine can be effective. And so the good things about this kind of medicine, this is a generic medicine. It's been around a long time. It's inexpensive, it's accessible. So that's very good. The biggest downside to using medicines like this is that type 2 diabetes is driven by resistance to insulin, not so much a deficiency of insulin. These medicines work by adding more insulin, so they can, as long as they are enough to make up for that increased in demand. It can be effective, but the downside is they cause your body to make more insulin. More insulin can make it easier to gain weight. Gaining weight can drive up the resistance to insulin so that you need more of it. So it can be a sort of a self-propelling kind of pattern. So it's not the kind of medicine we always want to go to in type 2 diabetes because of that. The other thing is, because it stimulates extra insulin production, they can cause low blood sugars. And we certainly want to avoid that if we can. So, so there are situations where these medicines do make sense. Again, a lot of time financially, if people are not able to take medications that have that are the newer branded medicine, if their insurance doesn't cover it, that they might not have that as an option. And these are inexpensive, and so that can work. They're pills, as opposed to injections. Some people don't like to inject. Nobody really wants to inject, but some people are more opposed to it than others. So this is another medicine that's a pill that can be used. So, and if somebody is somebody's not necessarily struggling with weight gain or ongoing weight gain, then that part of it doesn't seem to affect them as much. So these medicines have immediate release and extended release forms. The immediate release ones can be helpful to take like with a specific meal. So if I eat a big dinner every night and I don't eat much the other parts of the day, or I don't eat consistently the other parts of the day, I might just take one of these medicines. So I like either Glimepiride or Amaryl or Glipizide, and I might say take that once or twice daily with these specific meals. If somebody doesn't have as consistent of a meal pattern, but I still think that their blood sugars are going up after they're eating, they're not making enough insulin, then using an extended release, Glipizide extended release, can be a good match for something like that. You just have to make people aware of the fact that they need to eat when they take these medicines. If you get sick and you don't feel like eating, then you should hold that medicine. You shouldn't take it, because if you take it, there's a good chance you'll have a low blood sugar. There are similar medicines. They're not as commonly used, but they're very similar, and they just work a little faster, and they're a little more quicker on and off than these medicines. They're called meglitinides. So there's two of them. One is it's easier to say the sort of the brand names. One is called Prandin. The other is called Starlix. They're pretty much the same mechanism. It's just that they work a little quicker. So they don't have the extended release versions. But again, you can use that, take that with a specific meal if you tend to go up after eating. Again, as long as you tie it to food, then you're not going to have as much trouble with hypoglycemia. And again, if that person is less has a lower tendency towards weight gain, it can be a good fit. It can be, it's one of the situations it can be helpful is, let's say, as somebody who's not obese, but maybe they had part of their pancreas removed because they had a tumor. So now they have some insulin producing capability. It's just limited because they got some of it removed. So, basically pushing those cells to work a little harder, the ones that are left, sometimes that's all that's needed to make up the difference. So again, sulfonylureas and meglitinides, those are very similar medicines that can be used strategically for certain patients with type 2 diabetes.